from 61.9 to 67.2. Okay? So we move to the one and only, our special champion. Why is this champion special? So timeliness, scored 69% of the total weight, ranked 7th. In accuracy, scored 97% of the total weights, ranked 12th. You can see now there's a balance, yeah? In the other counties I presented, you'll notice that doing very well on one thing and not doing very well on the other. But in this county, you can see there's a balance. Then, areas of improvement, they still have some weaknesses they need to work on, like the ACF data. They also need to work on HIV testing. They also need to work on DR surveillance. Then, looking at just other performance highlights, did very well in overall quality of care, but were not the best. They were second best. Gene expert indicators also scored very well. Commodity reporting scored the maximum weight. TPT data, a few challenges. But still, overall data completeness needs a bit of work. But please note that the national completeness was also not doing very well. We were still in the 50s, even us. Then, of course, scored very well on ensuring that there's no rejection from the reference labs. So this county was ranked number 1, scoring 69.4% of the total weights, and was our previous champion, still is the champion, Homa Bay County.
Homa Bay County, kindly with your team.
Yes.
Team Homa Bay, kindly. So this award will be presented by the head of the program. Homa Bay, kindly with your all implementing partners.
Very good, very good. Homa Bay. Okay, tulisema hata ule mwenye amezaliwa Homa Bay ajibambe.
Mwenye amezaliwa Homa Bay kati mnaweza join them.
You can see clearly. Thank you so much. Thank you so much, Dr. as she hands over the mantle. This is very good. This is very good. Thank you so much. Thank you so much. As you take the certificates. Okay, thank you so much. Thank you so much. Hey, Bwana Kalori, thank you so much. That is, wow. Thank you so much. Yeah. Just have one good photo, and of course, Eban hata wewe ingia hapo. This is your meeting, kindly. Ndio hiyo sasa. Allah. Hey. So Karoli, you have given them a challenge, and to be sincere, this is good work. This is good work. Thank you so much. Thank you. We really appreciate. Asanteni sana. Thanks, the head of program. Okay. All right. So this is the first county that has retained that number 1. Now we need to ask ourselves more questions. And of course, if you may want to go for an exchange program, think twice. Tafuta county resources, tembea pale uone what they are doing. Thank you so much, and I want to take to Martin and then Dano as we finish.
So, of course, as we celebrate the top county, we also acknowledge that they dropped their weights a little bit, still within 69, but dropped from 69.8 to 69.4. But the gap between them and the second is a whole 2%. But of course, this is the first time in the 5 years we've done this that one county has retained the top position, and it is back to back. So we really appreciate Homa Bay County. And as of course I step off, I want to appreciate the people who helped make this presentation successful. Colleagues, Timothy Kandie, Elvis, Richard Kiplimo, Laura Unzere from NTRL, Albert from Kisian and the Kisian team. We also appreciate KCCB for the awards. And of course, program officers, always continuously improving the scorecard. We also appreciate you. And of course, we appreciate all the coordinators, because you make this possible. You make us able to analyze data in a very different perspective. We also appreciate the head of program for allowing us to experiment with data to this particular level. For those that we haven't met, I'm still Martin Gidiomi. I work for the National TB program, and thank you very much.
Sasa tu appreciate Ivan Martin. Sivyo? Haya, situ tu panua. Rembesha kidogo, rembesha kabisa, angusha tena. Santeni. So I'll just take you briefly to the last part of the program, kindly. For the guys who I'm going to invite, please, less time. I want to take this opportunity to welcome the chair of the county directors of health, which I'm being told is also the best county. Kindly, you can come and address 5 minutes kindly just on behalf of the county directors who are in the house and the county team. Then later I will invite Rafael Pundo to invite the MD, and then we'll flow the program. Kindly let us up between us, and then we disperse kindly.
So, good afternoon, everyone. Good afternoon once more. May we give a round of applause to all of us. I want to take this opportunity, number one, to thank the Division of TB and Leprosy for having organized such an important meeting. The review meetings are important to us as counties. You've seen among ourselves, we are able to learn from each other. We are able to track where we were and where we are going and where we're supposed to go. I think this is important because our health policy 2014-2030 stipulates that we're supposed to eliminate these communicable diseases. And Kenya as a country signed a commitment that come 2030, which I think is just some 6 years and some months, we're supposed to have eliminated TB, HIV, neglected tropical diseases, hepatitis, and the like. So I think the question is, where are we? Are we able to do this within the 5 years that are remaining? But of course, we thank the partners in this space. You've made it happen, and the support that you've given counties, cutting across, the technical assistance, equipment, the drugs, and all that, including research. The head of TB and leprosy, we want to thank you because you've brought what we call positive competition among ourselves. We know Homa Bay scooped it, but again, maintaining the top is never easy. So I think I have the hardest task, more than all of you, to ensure that we maintain it, we ensure that the quality of care, as far as TB is concerned, is achieved in Homa Bay. What made me so happy is when I was looking at our data, and leprosy at some point, even in the Bible, it was a disease when anyone heard that you had, everyone was running away. But I'm happy that the 11 ones in Homa Bay County were all treated and went home successfully. These are the stories that me and you feel happy when we hear. The treatment success rate. A patient comes sick and goes home treated, goes home cured. So we all know that TB for sure is a preventable and a curable disease. And this also gives us a space, gives us a chance to benchmark with each other. Like Homa Bay, I think we've received a letter from Mombasa. They'll be visiting us on Monday, just to check how are we doing it. I think let's learn from each other, and I think this one will help us improve and of course, improve the quality of care amongst the patients we are treating. We know very well that MDR-TB is still a challenge, it's still a public health threat, and of course, a health security threat. And let's see how the cartridges can be availed on time to ensure that we don't miss out on anybody. I will also encourage us that let's see how research and innovations can get into this space strongly. And I'm happy at least during the conferences, we've seen a number of us come to the conferences to present. And I'm happy to tell you that Homa Bay started one of what we call best practices conferences, where we feel things have gone well, we bring ourselves together and learn from each other. So I want to thank all of us, in conclusion, for creating time to just come and sit in, listen, share, ask questions for improvement. So once again, Minister of Health, we thank you. The counties, the directors, reaffirms again that we're going to give you an enabling environment, an environment that will help us, all of us, work together for the better health of the population of Kenya. Otherwise, thank you very much, and I wish all of you journey masses.
Thank you. Si tu appreciate the coordinator ones. So tu panue moja and then tu angushie moja. Haya, panua, angusha. So thank you, Director. So I want to take this opportunity to welcome Rafael Pundo, the Chief of Party Health IT, kindly.
All protocols observed. Good afternoon, everyone. I'm not here to make a speech. I'm just here to reaffirm Health IT's commitment to this particular process of leading with data. And I think we can see that data tells stories, and I'm hoping that next time when we tell stories through data, we could also have some human stories accompanying the data that we have. That should be in the next partner performance meeting like this, the program performance meeting like this, so that we're able to put faces to those particular numbers. I want to appreciate the partnership that exists between the University of Nairobi and the Ministry of Health, and also the partnership that we have forged between different partners supporting the TB program. At the top of that partnership is the University of Nairobi Vice Chancellor, and the University of Nairobi is represented here by the University of Nairobi Enterprise and Services Managing Director and CEO, Mr. Seth Becker. So I'd like to invite him to just say hi to the team. And then after that, I'll return this program back to Adano. Seth Becker.
Good afternoon. My name is Seth Becker, the Managing Director, UNES. And as you heard from Rafael, UNES is a consultancy consortium of the University of Nairobi. I have been sent by the Vice Chancellor to represent him here and to pass our greetings to the team here. We are really excited with the progress that we are seeing as a country, and we really appreciate the program for what it is doing to the nation. I've just seen the performance of the members, and I think I'm so happy that as we leave this workshop, we are all winners. That you can see everybody is happy and working towards maintaining success and be part of the success stories. So there are a lot of issues that Martin has encouraged us to focus on. I'm sure in the next meeting, we'll have a difference in terms of performance, because 69% is not good enough. There are areas of improvement that we need to work on, and as the University of Nairobi, we are ready to support you. Rafael and the team have been very keen in terms of supporting in the systems, and I'm happy that the system is delivering. And you can see the results of the system that we have been managing. And I'm so excited that you're able to engage with the team, the health IT team, in the work that you are doing. As a university, we still want to assure you of our commitment to support you. Health is critical. In fact, in some words, they say, your health is your wealth. So as a team here, if you want to measure our performance in terms of health, we need to look at the indicators that we have put forward, and we are measuring them. And we can see progress, and even the national level, we can see the progress. So the indicators are really showing good results. We are in the right trajectory, and we are supporting the national government agenda and the county government agendas. And we have an academy. I don't know whether you are aware, the MOH has an academy where we'll be engaging on these issues, the NCDs and non-NCDs, that we find solutions to the Kenyan problems. I think as the director mentioned, we have local solutions, and we should maximize on these capacities that we have. I'm happy that the local capacity is here, and as has been demonstrated throughout the days that you've been here, and let us see that we make our country thrive so that other countries can come and benchmark with Kenya. Just the same way we've seen Homa Bay what is doing, we want to see other counties seeing what Homa Bay is doing and is also improving. I think the others who are not in the top rank, they have an opportunity to improve on those indicators. I think without much ado, I just want to wish you all the best. As you travel back, we are still available as the University of Nairobi. Thank you very much.
Thank you, thank you. We can clap for them as they sit, sivyo? Unataka si tufanyie ile KANU style, sivyo? Haya, 1, 2, 3, twende. Funga. Fungo. Thank you, thank you. So I want to take this opportunity to welcome Dr. Maurice Maina on behalf of the USAID government for brief remarks.
Good afternoon. Wow, I think I'm the only one standing between ourselves and lunch, and I will try to make this brief. Mine is first to thank all of you for very productive 2 days. We've learned a lot from each other. I've learned a lot from the counties. And I must say that, you know, the counties, you are where the rubber meets the road. You are the ones in touch with the patients. You are the ones having dust under your fingernails. And if it were not for your efforts, we would not be able to see the outcomes that we've seen here the last 2 days. So thank you, and continue putting the right effort as you've done, and so that we can be able to see our statistics nationally for TB getting better, and most importantly, remembering that in all we do it for one thing. We are here to save lives. We are here to have the people we serve have better treatment outcomes so that they can live and they can be productive in what they do. My other comment I would want to say here is that as counties, we'll be picking a few counties to support with the development of strategic plans, which are county-based. We've not agreed how those counties will initially be selected, but that is something we want to start with a group of 10 counties beginning April or thereabouts to about September. So we would want to request those counties, if you are picked, that you work with a team from CHS, TBAC, to look at the National Strategic Plan for TB and see how that can be operationalized in your county, so that you have a county-specific document that becomes your roadmap to improving your TB control indicators in that county. That plan will be developed in the county together with all the stakeholders in the county. It should mirror what we launched in January, the National Strategic Plan for TB 2023 to 2028. So my plea to the county directors, to the county leadership, if your county is among the first phase, that you work with us to make sure that that document is developed in a collaborative way, in a way that it looks at the local solutions, is funded a bit by the county. You're able to know how much funding any donor is providing to the county for TB control, so that at the county level, you work as one team to ensure that you're making progress towards TB control. My other point is that these meetings for me are highlights of the things we do, because I'm able to see how we're doing as a country and at a granular level, at the county level and the sub-county level. So just to reassure you that these meetings will continue to happen, and we'll look for even more innovative ways to incentivize the counties that are best improved, not just with awards, but working with counties so that they can be able to do things like writing scientific papers, so that they can be able to show as a county what you're doing internationally. If you are a CTLC or if you are a county director, you have the data, you know what you've done in the past 1 year, you can write a paper that can be submitted in an international conference, and that is something that can be supported. So that that individual effort, or as a team, then you can only be able to see it not just by receiving an award, but also by getting something that can grow you professionally. Other than that, then I just want to thank you, all of you, and wish you journey masses, and thank you for being with us for the last 2 days. Thank you.
Sawa sawa. I think we are going to appreciate him a bit different. So Dr. Maina, you can just, as he waves, tuna clap sivyo paka akuje akae. Sawa sawa. Si ametoka ile side ya hiyo. So unamjua? Haya sawa. So Dr. Maina, you wave and then hawa wana clap. Paka yeye akae. Ila tu pole pole ukitaka. Thank you, Dr. Maina. So I want to take this opportunity to welcome the head of the program, who's going to do the program update and then closing. And then later I will invite Ivan for vote of thanks. So as Dr. Kadure moves to the stage, I'm being informed that the best county, Homa Bay, second best county, Nyamira, best sub-county, Bomachoge, Barabu, mnaambiwa mubaki nyuma kidogo. Watu wa communication sijui wanataka kufanya nini. That's what they have been told. Then as you also go out kindly, there's a NSP that's supposed to be picked by CTLC and the implementing partners. Kindly.
Good afternoon. Hey, okay, I can feel the hypoglycemia. Good afternoon. See, I thought niliona watu na ndizi, na chai, na sausage, but we are not saying anything. So mine is first and foremost to appreciate and acknowledge all of us for our patience and taking the time to stay on to the very end. I always say, I'll reiterate something I said to the other team, that when the last day comes and the hall is full, that shows you commitment. And for that, I sincerely wish to appreciate all of us. Secondly, I really want to thank the county teams and the program officers, plus the partners that have been supporting us. 2013 came with, we would say, a year of blood, sweat, and tears. But we stayed on, we fought on, and we succeeded. So can we give ourselves a big clap? It always pays to also be able to look back and appreciate the work that we have done. And I want to believe that having surmounted the challenges that we did in the previous year, we'll be seeing a lot of improvements and greater strides in this coming year. I'm hoping that this is the year we will hit 100,000 in case notification and even exceed that. So we still have quite some work to do. Now, standing between you and lunch, I'll be very quick, so forgive me if you can hardly see what I'm presenting. So first and foremost, I want to thank all of us for the successful launch of our National Strategic Plan that is now available. As you've heard, you'll pick copies. A strategy that is very ambitious, that first acknowledges the great strides Kenya has done in achieving and surpassing the 2020 milestones for NTB strategy. So we are one of the few 7 countries that have achieved these milestones, having realized a 56% reduction in TB mortality and a 38% reduction in TB incidence against targets of 35% and 20%. So let's clap for ourselves. Secondly, the vision and mission of the strategic plan is very clear, that it is our desire to create a globally competitive and prosperous nation that has 0 TB deaths, disease, or any suffering as a result of tuberculosis. However, making sure that people or Kenyans are able to access cost-effective and quality-assured services, and having the grand dream of ending TB and leprosy by 2030. We have various targets, as you will see in the strategic plan. I'll request in the interest of time not to go through each one of them, but to remind all of us that the program does not just focus on tuberculosis. I know we've done a lot of celebrations for TB, but let us not forget our other 2 children, that is leprosy and lung health, because they're also critical components of the work we do, and you will be seeing a lot of activities around the 2 of them in the coming days. So looking forward to the days ahead, what is going to be our focus? 1 is to optimize the current patient-centered TB interventions so that at the end of the day, we're looking at improving our point-of-care services and making sure these services respond to the unique needs and the requirements of the people that we are serving. Secondly, we'll be seeing a period of very rapid and accelerated scale-up of very many new interventions and innovations, because Kenya is a country that prides itself as being a rapid adopter of new technologies, and this is to make our work easier, our diagnostic quicker, more accurate and more timely, and making sure that we improve the quality of services. Thirdly, we'll be working very closely with the community structures on the ground, leveraging on the universal health coverage and community systems. And my appeal to all of us is, as counties are operationalizing the primary care networks, let us not fail to be at the table. One of the things that the program will be doing very soon is providing guidance to counties on how best we can tap into that particular resource and make sure that we use that to help us find the missing cases that are within the communities that we are serving. In addition, we are shifting away from having a national focused to a subnational focused way of implementation, with pandemic preparedness and operational framework planning happening at county level, just to make sure that we are able to have subnational plans that are able to respond to the unique needs of every county. In addition, we'll be looking at leveraging on not just the community, but ensuring that our responses are ensuring equity and human rights and gender rights are upheld. So we'll also be seeing a lot of conversations in that space and a lot of attempts to empower communities. One of the things that I encourage us to adopt is a message that the HIV team has successfully used. The young people, the adolescents and the young persons are known for saying nothing for us without us. Now the challenge I'm throwing to all of us is, 1, for the counties, nothing for the counties without the counties, or sub-counties for that matter. But also 2, nothing for communities without communities. So even as we are walking this journey together, we have seen the significant role that community actors have played in TB control. As a program, we have pledged to continuously work with them, and I hope that we will ensure the same happens at the county level, even as we are planning. And then making sure that we look at TB not just as a medical condition, but also addressing the social determinants of TB by ensuring a very collaborative multi-sectoral approach in the way we do the things we are doing them. So for the strategic plan, one of the things that has been mentioned, I'll just emphasize the need to have subnational county strategic operational frameworks that are aligned to the local epidemiology and making sure that the development process is all-encompassing and incorporates all the people within the county. In addition, we are in the process of rolling out the shorter-term regimen for drug-resistant TB. We initially had a vision to do that on the 1st of April, but due to delays in some of the commodities, this process will now be happening on the 1st of July, where we hope to shift all eligible DRTB patients on the 6-month BPAL-M regimen. We will be going through a series of sensitizations and awareness creation programs for the same, and we'll be counting on your support for that as well. Now, the other thing that we have successfully done as a program is to roll out a shorter-term regimen for children for TB, whereby children with non-severe pulmonary TB are now supposed to be on treatment for 4 months. However, the rollout, despite being on 1st of January, has encountered a few setbacks. And I think the appeal that I'm giving to us as we go back to our facilities is to make sure that every child that is eligible is actually initiated on this regimen and that reports for the same are reported or made or placed accurately. So between January and 20th of February, we had a total of 882 cases of treatment of children on treatment for TB, of which 258 were eligible for the shorter-term regimen, but a paltry 22 were notified. From where I sit, I think one of the challenges we may be facing is the quality of the data within our facilities, because I know and I have confidence that the healthcare workers were sensitized and are aware of what they're supposed to be doing. So let us go back and look at the reports that are being generated in our facilities and making sure that those children are categorized correctly. Secondly, for those facilities where there is need to continue with the sensitizations, we have the eco platforms that are going on, the eco sessions, so that we make sure as many of our healthcare workers are given the skills to give them the confidence to actually categorize a child as having non-severe TB. And we should not wait for the x-rays. The guidelines and the tools that we've been given are able to guide us to do a clinical categorization of those patients. So let us work with our healthcare workers just to make sure that that is the case. I'll not go through the treatment regimen. I think that is something we all have. Now, just a breakdown of some of that data and to demonstrate that in counties, for example, like Mombasa, we had 64 pediatric cases, 18 were eligible, but only 4 were actually initiated or reported as being on the shorter-term regimen. And we can see across the other counties, we seem to have a similar pattern where many children were diagnosed, but not all of them were put on treatment. However, counties like Bungoma seem to be heading there, and we hope that they can close the gap for the remaining children and the rest of us can pick that up. I'll not go through this, but just showing the eligibility, that almost every county had a child that was eligible. Now for World TB Day, it's a day that is coming up soon in this month of March. We normally celebrate the day on the 24th of March, but this year we will be doing it differently. We'll commemorate the day on Monday, the 25th of March in Murang'a County. And our theme remains, yes, we can end TB, with a focus on embracing primary health care as the cornerstone of our fight against TB. We want to move TB control to the grassroots. Remember, we are working in a government that uses a beta approach. So we cannot be left behind that bandwagon. And unfortunately, again, or rather, just to clarify that this year we will not be providing resources to the counties, but we hope that now we've empowered the counties enough to be able to undertake their own resource mobilization. And I have seen in the room there are many partners. So we just need to strategically position ourselves and articulate the requests with the partners in the county. However, we also want to rally an advocacy call to all of us so that at the end of the day, we are accelerating the TB response in ensuring access to care. We want to improve access to care, nobody should struggle to find TB services, irrespective of where in the healthcare system they show up seeking services. For the DRS survey, we know that DRTB, of course, has a high morbidity and mortality, with 50% of our newly diagnosed patients being drug resistant. Now, we do not quite know what the current strain of DRTB that is circulating, because of course we've not done genome mapping. And we've also had a couple of changes in the treatment regimens over the last couple of years since the last prevalence survey was done. We also know that the drugs we use for drug-resistant TB are also used for many other conditions, including routine bacterial infections. And therefore, the essence of this DRS, the drug-resistant TB survey, is to target new and previously treated patients, and it will be done nationwide in 29 counties, a total of 50 sub-counties. And we'll also have an additional focus in Nairobi to look at co-infected patients and see whether there are any differences that might be arising. Of note is that in this survey, unlike previous surveys we've done before, we'll be introducing genome surveillance, where we'll be mapping the genomic strains of the TB that is circulating, so that we can be able to see, is it the same strain across the country? And then in subsequent DRSs, we will be able to track the pattern of movement of these particular strains and put in place data-informed prevention strategies. We have a few other ongoing surveys. We have the stigma index. We have the burden of TB among healthcare workers. We have the CAP survey, the prevalence survey for TB in Nairobi, done by KEMRI and University of Washington. And we also have a DOD study looking at TPT among DRTB contacts. However, I want to emphasize the fact that all these studies will be done with the county teams, so that at the end of the day, we also want to build capacity within the system, within the structures, so that tomorrow it's not the program that is actually coming up with a concept. We hope that ultimately these concepts will be developed at the county level, and resource mobilization. This is where as a program we come in handy. If you need us to help you with resource mobilization, you have a good concept, you're able to bring it to us, we are here to be able to help you with that process, and we'll be able to see what we can do. Now, one of the highlights of this meeting has been the last two sessions. One was the feedback from the county to the program, and the other one was the feedback from the program to the county together with the award ceremony. Now, I want to just give the commitment on behalf of the program that we will take those reports very seriously. We will go back and look. Do not feel afraid. Do not hold back from telling us areas where we can collaborate and work better to improve the services that we are giving you. Remember, the program is here to serve you, just as we are helping you to serve the people you're serving within the facilities. So we'll be coming back to you for areas of clarification where we need that, but we also want to work together with the teams to harmonize the two reports. One of the things we noticed is that in a few places there are discrepancies, where one report says this, but the other report seems to give a completely different picture. But we will be working with you to identify what the actual issues are and make sure that those are addressed. The other commitment that I want to give on behalf of the program is a turnaround in our commodity and supply chain management system. I know we've faced numerous challenges in the year that has gone by, and we have worked tirelessly day and night to make sure that we can reestablish the integrity of our pipeline. However, I have an appeal. And the appeal is for all of us to make sure that when we are called upon to report, can we make sure our facilities are reporting 100% and they are reporting on time? So one of the things that we've agreed as a team is that we have to start by also being hard on ourselves. So the requests for resupply and commodity distribution have to be done on time. You can ask Dr. Omar and their team. If they don't give me their report on their request on time, I just won't forward it for approval. So it means when your reports are due by 10th, it means the memo has to be on my desk by 15th, and it must be in KEMSA by 20th. Remember, it has to go through the ministry. So if by 10th your sites have not reported, and that month's report is downloaded, they will have to wait until the next month. It's painful, it's going to hurt, but it is the only way we can turn the system around. That is where I'm appealing for your help, because the officers in the program know, once Daktari's deadline has reached, don't even bother giving her your memo. She won't sign. She will tell you now hapo utajipanga. And that means for them to do that, it means they have to stop downloading your report on a certain date. So if they download and your report is not in, unfortunately that month you'll have to sort yourself out. So for us to make sure that we work together, and since the timelines are known, I'm appealing to all of us to make sure that we adhere to those timelines so that then we make it easy for all of us and we have a consistent way of managing this situation so that tomorrow, when we are quantifying, we are very clear on how much it is that we need to quantify for. The other thing that we'll be doing moving forward is matching our consumption data with our notification data. Initially, we were pegging a lot of the distributions on consumption data, yet we realized not all the facilities were reporting. Now, moving forward, that is going to change. So my appeal is to all of us to make sure that we are able to adhere to that. But with that, I really want to re-emphasize my sincere appreciation and gratitude to all of us, wishing us all a very safe journey as we go back, and just reaffirming the commitment that we have to make sure that we build the capacity of the leadership at county and sub-county level for TB control. One of the things we will be seeking to do is to revamp the county and sub-county management trainings. We had a training that was helping us to know how to better manage, to be more effective managers. We will be bringing that back so that at the end of the day, we are all developing a team of leaders and managers that are well able to steer this country to the next level when it comes to TB control. With that, I want to thank all of us. And as I declare the meeting officially closed, and welcome Iban to give a vote of thanks and probably the closing prayer. Thank you.
Declared closed. So mine is just to probably repeat what has been said by appreciating all of us for being here. And I want just to mention some groups, not in a particular order, but let me start by the planning committee for this particular PRM. A lot has gone into making sure that all these things you are seeing here has been realized, getting a venue and so forth. So Adano, the M&E team and the committee that was planning, you can stand for a round of applause. If you know you are in the committee, and I know it was a multi-sectoral committee from LIT, CHS, so the rest are not here. So thank you so much. So you can see the organization, if there is any 100% organization that is attributable to that particular team. Of course, I was part of the team, so you also need to clap for me. Thank you. So I also want to thank LIT for being kind enough. Of course, USID for providing the funds, Dr. Morris. And I'm happy that you have said we will continue meeting in this particular. You had from the horse's mouth that yes, we already mobilized resources for the next year. So the planning begin in earnest, Adano and the team. So thank you so much. So USID and LIT for the support. Going next is, of course, the partners. Is not in a particular order. All our partners in the room, thank you so much for our support, the support you give to the people in the field, in the facilities, in the counties. We much appreciate, even at the national level, because there are so many, I may not be able to mention any, with the risk of leaving someone behind. And therefore, subsequently, I think in the last meeting, I got a pitting from Nyakwana. Philip Nyakwana, thank you so much for coming. I hope you are here. You can stand, represent the communities, because communities are the reason why we are here. So therefore, we appreciate the role that the communities, and of course, as part of the stakeholders for this particular meeting and TB control. I want to appreciate counties, specifically the county directors, the county coordinators, lab coordinators, and sub-county teams, facility teams, for really the results that we are displaying here are your results. And the things that we are discussing here are actually yours. So as I said, when we were opening the meeting, shareholders meeting normally declare results and dividends. So the work that you have done is what we displayed here. So much thanks for being here. I also want to thank our colleagues in the National TV program for being here. They can also be given a round of applause, and they can stand. The TV program officers who are here, please stand up to be given a round of applause. So they have contributed in one way or the other, making sure that this particular meeting is a success, and we always look forward to your support. Thank you so much. I'm not sure whether I've left anybody. So the head of the program, the leadership in the ministry, of course, for their blessings, because without them telling us to come here, we would not have come. So we continue with the political support that we have and appreciate that. And finally is to thank the hotel for having been kind to us, giving us the hospitality that we hope that nobody has been offended or amekwaso fulani. Kama umesikia tumbo imeanza kurukaruka, then probably that is attributed to the hotel and what you have been eating. But yeah, we have so many pharmacists here, they can assist in giving you charcoal. If you miss the charcoal, there is a panning place somewhere there. You can go and have a toast one. Otherwise, from my end, I want to say thank you very much. And I know on the scorecards, if you are very analytical, and this is to many colleagues, there are things that you can see, the people who have improved. And I told Malika, Malika before he was number 47, because he was struggling with management issues. And I think he has, from what we hear, they are fixed those. The counties from the coast, and I thank Dr. Pusaidi is here, I think she was also struggling with management issues. So we can see what is attributing to what. For the county, we know, of course, where you are heavily leaning in terms of trying to score, and we'll try to make sure that so those observations are very important in informing and making sure that we're looking at this. So thank you so much. We hope to see you again in many other forums, but see you next year for this particular one. So we'll request someone to pray for us. Adano, you want to do this?
No. So before we are going to close with the national anthem, Ivan, probably.
Oh, okay.
So some few announcement. Kindly pass by registration and register yourself. Take the code kindly and ensure that that has gone through, please, kindly. So I think we can, there's somebody who left his glasses. Kindly, you can see us behind glasses. So we can stand for national anthem, and then we can depart.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu.
Thank you, everyone. We can enjoy our lunch. And safe journey.